topic will be Mpox. Mpox is an infection. It is caused by the monkeypox virus. Since May 2022, there has been a global increase in Mpox, including in the United States. Infection mostly happens from direct skin contact or through sexual activity. Anyone can acquire Mpox. There are groups of people that are at higher risk. Symptoms usually begin between 3 to 21 days after the exposure. Some people get early symptoms such as fever, malaise, fatigue or tiredness, headache, muscle aches, backache, swollen lymph nodes. Some other symptoms include rashes, pimple-like lesions, particularly in areas that are hard to find or identify, such as the genital region, for example. Other symptoms include ulcers, lesions or sores in the mouth, rectal pain with or without a rash. People with Mpox may be infectious 4 days prior or before symptoms start. People with Mpox can be infectious until all the lesions are crusted, scabs have fallen down, and a fresh layer of skin has formed underneath. Any rectal pain is completely gone. Most people with Mpox get better within a few weeks without any specific treatment. Mpox can spread with direct skin contact, with any rashes, blisters, or lesions. Contact with semen or other body fluids from a person with Mpox. Mpox can also spread by touching contaminated objects such as bedding or clothes. It can also be spread by direct contact or extended face-to-face contact with a person with Mpox. There is a vaccine, Genius vaccine. It is 2 doses. Anyone who has been exposed or potentially exposed to Mpox should receive the vaccine, including, for example, healthcare workers. Get the vaccine if the person is gay, bisexual, or other same-gender loving man who has sex with men, or are transgender, gender non-binary, or gender diverse, and in the last 6 months, the person has or is expected to have 1 or more sexually transmitted infections, more than 1 sexual partner, or anonymous or intimate sexual activity, sex at a commercial sex venue, sex in association with a large public event in a geographic area where there is a high amount of Mpox detected. The vaccine is also recommended if the person has or will have sexual activity with a person who is at risk of Mpox, or if the person has had or will have sexual activity with someone who has Mpox. The person should get vaccinated as soon as the exposure is detected, regardless of sexual identity and regardless of gender identity. Other ways of protecting against Mpox includes avoiding close contact with people who have Mpox or Mpox symptoms, avoiding contact with infected animals, avoiding contact with infected materials such as bedding or towels from a person with Mpox, practicing good hand hygiene. Mpox is diagnosed with swabs taken from affected areas. Most people with Mpox can manage symptoms at home by staying hydrated and taking over-the-counter pain medications. People who get very sick should go to the hospital and get an antiviral and intravenous fluids, among other treatments. I hope this information information was helpful. For more health education, please follow my social media. Thank you.